on Facebook and Instagram. Good morning. How are you doing?
I'm doing great. Good morning to you, Camille.
Outstanding. I am so excited to have Dr. Mary Hinckley from the Reproductive Science Center of the San Francisco Bay Area. We are going to have a great conversation, not a presentation.
Good.
We're going to talk about the impact of beer, wine, and caffeine on infertility. So if you'll give us 30 seconds, I'm going to just let people log on. I'm sure a lot of people are just seeing that we've started, so we'll give people a few seconds to log in so that they can be a part of this. So how's the weather out there in California? I know on the East Coast, we're getting drenched.
Yeah, no, it could not be prettier. We had a little cold spell a couple weeks ago, and cold spell in California is not very cold. But now we've had this beautiful weekend, nice, pretty sunshine, probably be a good 75 degrees today. So this is what we love. We love the falls in the Bay Area. That is our prime time.
Oh my goodness. It sounds like you guys just are in paradise.
Not always. We get the fires and the earthquakes, but this is the sweet spot right here.
Awesome. Well, I'm super excited about coming out there and visiting with you all next weekend. So for those of you who don't know, we are going to be coming to Livermore, California to celebrate the 35th anniversary of the Reproductive Sciences Center. 12,000 babies. Wow.
It's a lot of babies, a lot of people with infertility that have found happiness and success through the help in our clinic.
Amen. So thank you and your colleagues for all the outstanding work that you've done, and thank you for inviting Cade out there. They could have chosen to just have a big party, but you chose to have a fundraiser to give back to support even more families. So it's really been a real pleasure connecting with you guys, and I'm super excited about working with you all in the future. So I can't wait to come to California. All right, let's go ahead and get started. I will repeat, this is a conversation, not a presentation, and we're just going to chat. If you're logging in on either Instagram or on Facebook, this is open. So if you have a question or just a comment, send it in and we'll address it live on the air. And if you happen to be watching this as a recording afterwards, because it will be recorded and available on Facebook and YouTube, feel free to send your question in and we'll do the best that we can to get that answered at that point in time. So I'd like to thank everybody who's actually chosen to spend their lunch break with us. Yay for lunch break. So let's jump right in. Dr. Hinckley, tell me a little bit about alcohol. Does alcohol impact infertility? Does it make it more difficult to conceive? Does it matter?
Yeah, so, it's a good question. I get asked it literally every single patient that comes into my office because our society is a society that celebrates, and we often celebrate with alcohol. And so it's important, and we have some really clear medical studies that show a negative effect of alcohol on pregnancy. So we know there's something called fetal alcohol syndrome. We know there are neurobehavioral problems that come from women who are drinking alcohol when they're pregnant.
Okay.
But the real question is there a problem in trying to get pregnant with alcohol? And those studies are a little less and a little smaller. So there really is a paucity of good clinical studies looking at this very question. And yet there are some, and that's what we draw our advice on. So to answer your question, there is a known link in infertility with alcohol. Exactly how much alcohol, exactly what type, we still need more studies, but we know that there is an effect. The sort of key points are high amounts of alcohol for women may lower their egg reserve. It may even cause them to go into menopause a bit earlier than they otherwise would.
Okay.
For men, we know that alcohol can lower testosterone, and it can cause testicular atrophy at high quantities. And we even know it can change the sperm morphology or shape. So we see problems both with women and with men with high amounts of alcohol. We also see sorry.
When you say high amounts, do you mean 1 glass, 2 glasses? Are we talking a whole keg? I mean, what are we?
So again, that's where the studies leave us a little bit to draw our own conclusions or need more work from the scientists to figure it out. But in general, we consider binge drinking to be more than 4 drinks at a single time. We also consider moderate alcohol consumption for women to be more than 4 drinks in a week. So, I mean, that's a pretty tight cutoff for people who actually are fairly social or go out. Even if people aren't social and don't go out, if they're drinking 1 glass of wine a night, they've crossed over that threshold. So again, we see problems when people are binge drinking or drinking more than 4 drinks a week.
Okay. Well, that's good information.
A few other things as well. So we knew there were problems with egg reserve and sperm, but we also know there's an increased miscarriage rate. And then in some of the best done studies so far, we've seen a direct impact on lowering the success rates with IVF, in vitro fertilization, if women and men are drinking in the month and especially in the week of their egg retrieval. So of course, if you're doing fertility treatment at the upper ends, IVF, this is when it becomes critical to really watch your intake. If you're just someone out there trying for the first time or beginning your journey, it may be more okay for you to indulge in less than 4 drinks a week at this point.
Okay, we just got a question from Kristen Nickel, and she's asked, when should you cut off alcohol before an FET? Like a month before or more? Thank you, Kristen, for that question.
Yeah, Kristen, thank you. That's a great question. So definitely a month before. So based on some of the data looking at IVF, and since a FET is a frozen embryo transfer, so that's when we return the embryo back to the uterus, we would definitely say a month before. Prior to that, it may really depend on how much you drink. Alcohol can have effects on the liver and on your ability to metabolize hormones. So if you've been drinking a lot, maybe you need to start backing down more than a month before, but certainly that month before.
Okay, great. I've got another question that actually leads us to our next topic. How does caffeine impact infertility? And the question came from Kelly Popwell. What limit of caffeine should you have before IVF? How many ounces?
Good question. So as we all know, we can make our ounces more potent or less potent. So really, we usually measure caffeine in milligrams. And, you know, a typical cup of coffee may have somewhere around 100 milligrams. Now, if you make it really strong, or you go to some store and make it really strong, that can change the amounts. But we do recommend that women have around a cup a day or less when they're moving into fertility treatment. The studies on the effect of caffeine on eggs and sperm do not show actually a huge effect or a negative effect. However, there is a decreased success in live birth, meaning there's a higher incidence of miscarriage if women are drinking more than 3 cups or more than 300 milligrams a day of caffeine. And we know that in super high quantities, like big gulp quantities, that caffeine may even have an effect on sperm. Now, there's some newer research. Oh, yes.
So we got a couple of questions in here about that. I know a cup of coffee a day is okay when you're starting treatment, but are all coffees the same? So can I get a cup of espresso from Starbucks? Is that the same as a cup of decaf from Royal Farms, which is a gas station out here that serves coffee? Kind of what, if you don't know the milligrams, what's kind of just a good rule for thumb? Can we do espresso? Does it have to be decaf? Or can I just do my regular Joe from Dunkin'?
Well, that's a good question. And again, usually you can Google really quickly and find out Starbucks or, you know, Seattle's Best Coffee or your local spot and find out how many milligrams. But in general, 1 cup of something a day. Now, I was about to mention that there are some newer studies looking at decreased blood flow to the ovary if you're drinking even 1 cup a day. So if you really are having challenges with egg reserve and trying to increase the amount of eggs you can produce, it might be beneficial to cut all coffee out when you're starting treatment, because it may be lowering the blood flow and therefore lowering the delivery of the hormones that you're injecting. And of course, you want it to work as good as possible so that you can get a higher number of eggs and better success. So I do recommend most of my patients try to cut down to at least 1 a day and maybe cut it completely to get the optimal success if they're doing treatment.
That's okay. That's great so if you have low numbers of eggs or poor egg quality, just cut it out altogether.
Yeah, I think, of all the things you can give up, I think it's not so hard to give that one up or to try to trick your body. Now, Camille, you were telling me earlier, I was saying out here it's still morning time. So this is my cup of coffee for the day. And over time, certainly after medical school, I've been able to trick my body into having decaf coffee, which I know still has some caffeine. But again, sometimes it's the ritual of it. It's the having the time to have a cup of coffee or tea, and you might be able to cut down the milligrams of caffeine to make it so that you don't have to give up your ritual.
So speaking of tea, we just got another question. Is tea okay? And are there specific teas to stay away from?
Tea is okay. Again, you can look at the caffeine content. There are some teas that are made from barks of trees that maybe have more homeopathic qualities that we'll often recommend staying away from and having more of the mainstream types of teas. But again, most tea is fairly dilute, is going to be okay, and it usually has less caffeine content per ounce when you're drinking that. And so for a lot of people, that's a good way to step back on their caffeine and yet still have something nice and warm when they're wanting a little pick-me-up.
Okay, all right, that's good. So stay away from the homeopathic teas, stick to mainstream teas when you're trying to get pregnant, and always talk with your doctor.
Yeah.
Okay, that's great. That's wonderful. All right, so we've talked about kind of alcohol in general. I'd like to dig a little deeper. And for those of you who don't know, I'm super excited. We're coming out to have a Corks with Cade, which is a wine tasting event to celebrate the 35th anniversary of the Reproductive Sciences Center. And we'll be there on Saturday, and tickets are still available at universe.com/CA Corks with Cade. Shameless plug, but we will have wine at that event. Is there a difference between wine and beer and different spirits like vodka or just gin, some of the other alcoholic beverages?
Yeah, good question. So a lot of the studies are not really powered to show a difference between different types of alcohol. So it just means they weren't big enough. There weren't enough people who volunteered for the study. Even sometimes in studies on alcohol, people are embarrassed to say how much they drink. So it can be a little challenging to really dice out each type of alcohol and its effect.
Okay.
We know that there are some good studies that even show red wine can be beneficial for you. A glass of red wine a day is good for your heart. It's good for your cholesterol. There are certain properties within that red wine which may be beneficial. But anything in excess can then backfire and have negative effects. And so my perspective on this, based on reading the literature, is that certainly beer and wine may be a better alternative than spirits based on some of the studies. You're going to limit your intake a little bit more with beer and wine just because of the content, the density of it. And so you can probably stay in a safer zone of very infrequent drinking and still be able to be in those early parts of trying to get pregnant.
Okay. Well, this is good. So this is interesting. I know a lot of people, like you said, have these rituals. I have coffee every morning. It helps me wake up. I have a glass of wine with dinner every night. It helps me kind of relax and settle down. And so what I'm hearing from you is when you are working to conceive, particularly if you have been struggling with infertility for some time, because you mentioned, kind of the people who are just coming to the fertility treatment world versus those who've been in the struggle for a longer period of time. You may have to change some of the lifestyle choices, including cutting the hard liquor, moving to beer and wine. And you mentioned red wine was preferable, but I think that what I heard loud and clear from you was everything in moderation. We're not going to switch from drinking straight vodka every day to 3 bottles of wine. We're going to just pretty much cut it all out, with exception, maybe a little bit, right?
Right. I think one of the hardest parts for women, men, and especially even as couples is really finding that balance. You have to continue to find a good quality of life, and changing everything dramatically just adds to the stress sometimes. And so I think it's important to really assess, what does the literature say, what's true, what's really going to make a difference, and how can I still find a good quality of life within that so that I can keep going. Because if you get too overwhelmed with this, if you get too depressed, you may actually stop trying, and that's no way to get pregnant. So we've got to keep you in this game, because human beings are not super efficient reproducers. Unlike some other species, we are not very efficient. So we really have to stay in the game and keep trying to wait for that perfect egg and wait for that sperm that's going to make the healthy baby. And sometimes looking at your environment and keeping some good rituals and a healthy pace in life is going to help you get there in a more efficient and less stressful way.
That sounds great. Kristen, do we have any questions on Instagram? Okay, all right, we're going to continue on. So balance. Now we're talking about beer, wine, and caffeine. And I know that we didn't prep for this, but since the laws are a little different on the West Coast than they are in Maryland, I'm also wondering about the impact of things like marijuana, which is legal, right? On infertility, and is it okay for those who partake to continue to engage or to continue to smoke, or however they ingest it, or should that be cut out while trying to conceive?
Yeah, again, a very timely question, especially with the laws changing in a lot of states now. In an internet-based survey that was done, I think about 2 years ago, they found that about 12% of women and a little bit higher percent of men are smoking marijuana weekly or ingesting marijuana weekly while they're still trying to get pregnant. And about 3% of women are doing it daily. So this is a very timely topic. We don't believe there to be a very strong effect of infertility on patients who are smoking marijuana. However, we don't really understand how it may be affecting their general health, and we certainly don't have enough data on how it's affecting the pregnancy to feel that it's safe. So at this point in time, as a physician, I'm recommending that people do not smoke marijuana or ingest it until we have more data really proving that it's safe, because this is such an important part of that next generation and that child and how they're going to do. So again, we don't have clear data to show it's a problem. So maybe backing down a little bit, smoking a little bit less, and maybe considering slowly weaning it off completely.
Okay, so wine, perhaps, or beer in moderation, no smoking, not because we don't know, and we want to make sure that if we don't know, we don't go. Just say no until you know. And then cut the hard alcohol out. But again, trying to maintain a positive outlook. So for those people who would say, well, these are things that are, a part of my daily ritual. And I know you said it's important to maintain a positive outlook and to stay hopeful. So what would you suggest as a replacement for some of these things that people have come to rely on just for waking up or going to sleep, or just kind of, for managing daily life? are there substitutes people may consider?
Well, there are. I mean, there are substitutes in the sense of, we talked about decaf coffee or, non-caffeinated teas, so that you don't have to change things completely. But actually, some people do quite well after maybe a couple weeks of really shifting and giving up a bad habit. So they may go for a quick walk in the morning, refreshing, listen to some meditation on their headset as they're walking, and have a new way to kind of energize and reset. They may find that at night, rather than having a glass of wine and watching TV to chill out, again, they may do something different with their partner, and that actually may be even more relaxing, and bring about a better change overall in the relationship to build the basis for a healthy family. So again, there are changes that have to be made. There are ways to reboot and energize and chill out without drugs and alcohol, but it sometimes takes a little work to figure out what works best for you.
Okay, that's great. So, I was talking with one family, and they talked about how when they were going through this treatment, infertility treatment, they felt themselves being pulled apart from one another just because of the rigors of, timed intercourse and medications and, hormones that felt like they were a little out of whack compared to normal. And they started a daily ritual of reading together. They would read a book together. And that was their way of winding down in the evening. And so I'm just putting that forward. I guess.
I love that idea.
Yeah, so they would actually read it out loud. So, she would read one day and then he would read another day. But that was a way that they felt like they were tethering to one another, but also able to manage some of their stress. So,
yeah, I mean, you have to be creative, but there are lots of things out there, new board games, going back old school, going out for a walk around downtown where you might be doing some window shopping, art classes. I mean, sometimes bringing in that other side of the brain just really allows you with your creativity. And that's the same with reading a good book, really brings out a peacefulness that can come and help you get through these tough times. It is challenging. Fertility treatment is a stressor. It is a stressor on couples. And so you have to work hard. And there are a lot of great apps out there now that you can download to your phone to really help you get through some of these challenges. There's ways to use laughter and jokes to do it. There's ways to use peaceful meditation and prayer. So they're there. You just have to work hard to find them.
Awesome. And I think we're kind of running close. We have just a few minutes left, but we got another question that was snuck in about the red wine. People like red wine. Is any red wine okay? I don't like the dry ones like Merlot. I'm more of a sweet red or a sangria. What do you think?
Well, that's a good question too. And of course, again, I have to come back from a medical standpoint. We don't really know. So if your choice is a sweet red wine, go for it. We do know that sugar, though, and interestingly, some people it's really the sugar content and alcohol that draws them back again. We do know that sugar can have negative effects on the body, and everybody knows, okay, let's not eat cakes and cookies all the time, but we find sugar in lots of things. And so, really balancing your sugar with some protein might be helpful as well. So bring out that good cheese or a little bit of meat to have with your red wine, your sweet red wine, and maybe that would be a better balance for you.
I love that. That's excellent. Okay, so add the protein, cut the sweets if you can. I got a couple of comments. Great ideas. I love the replacement ideas. So this is wonderful. All right, so we are actually wrapping up. We have just a few more questions. If you are watching us, thank you for joining us. Please send in your questions. We're going to be finishing in about 3 minutes. And Dr. Hinckley, kind of as we close this down, do you have any last words or last thoughts about just the impact overall of beer, wine, coffee, and fact versus fiction? Tell me really quickly, what's one important fact and one thing that a patient has come out and asked you that was pure fiction?
Gosh, so an important fact is just to in regards to this alcohol consumption and fertility, an important fact is that it does have an impact, especially combined, both male and female alcohol consumption in moderate to high amounts can have an even greater deleterious effect. So it's not just one person's job, it's the job as a couple to really cut back. In terms of fiction, again, I think one of the things I hear is that red wine's so great, I can drink as much as I want and I can drink in pregnancy. And I would say that's not true. We really need to look at the quantities of alcohol and then the timing of it. And so again, in pregnancy, we just don't know that there's a safe amount. It crosses the placenta, it builds up in the fetus in much higher amounts. And so, even though we may feel all the Europeans are over there drinking, why can't we in the US do it? I think we have to be really cautious. But again, the good studies show that in the context of IVF, drinking alcohol, especially that week of an egg retrieval, can really affect probably egg quality and quantity and even fertilization. And that's where it may have its greatest effects. So back it down, a little bit more moderation. Don't believe everything you hear, especially if it seems too easy.
Awesome. Okay, well, I think at this point, we're going to have to close out. And I thank everybody who participated both on Instagram and on Facebook. Again, if you want to learn more, please follow up with Dr. Hinckley at the Reproductive Sciences Center in the San Francisco Bay Area. And I hope that all of you will come out and join us this Saturday at the Dante Robert Vineyard at Livermore, where we will celebrate the 35th anniversary of RSC. They have helped create over 12,000, they have helped grow over 12,000 families, over 12,000 babies over the past 35 years. So thank you for all that you have done and all that you are doing and even greater things that you have yet to do. And thank you guys all for joining us. If you, Mary, would just hold on, I'm going to close this out. But thank you guys. Before we finish, this is Coffee with Cade, so I hope that you all brought your lunch. And what is in your mug?
In my mug, that's that decaf coffee. So
that's good decaf. And I've got my Coffee with Cade mug, and I am drinking that good old-fashioned water. So H2O, agua, however you want to pronounce it, that's what I'm drinking. So thank you so much. You guys have a great rest of your day. Be well, and I hope to see you on Saturday. Oh, and for those of you who may have questions about the Family Building Grant, applications are available online, and you can get more information at cadefoundation.org. And these grants will provide up to $10,000 for fertility treatment or domestic adoption. Have a great afternoon. Mary, just hold on one second while we finish this out.